So I'm here today interviewing Dr. Daniel Heng, who I would describe as actually being a rock star in the world of kidney cancer. Dr. Heng is very modest, but he actually has a set of criteria named after him that we commonly apply in the clinic to ascribe risk to patients with advanced or metastatic kidney cancer. And Dr. Heng, first of all, thank you for joining us today.
Well, thanks for having me, Monty. That's great.
Excellent. You know, another study that's really garnered a lot of attention at this meeting is one that explores the combination of nivolumab with ipilimumab, another immune inhibitor.
Right.
Give us your thoughts on that study.
Yeah, so next generation immunotherapy is definitely the hottest thing in metastatic renal cell carcinoma. We're all looking for different mechanisms of action now because we have lots of VEGF inhibitors. We have 2 mTOR inhibitors. We really don't need more, but we need different mechanisms of action. So nivolumab is an anti-PD-1 antibody, and is currently being investigated in a phase 3 clinical trial for second-line therapy. But in this presentation here today, they looked at combining nivolumab with ipilimumab, a drug that's commonly used in melanoma, metastatic melanoma. And I think what was very provocative, and of course it's the early experience, it's still just in a limited subset of patients that are very selected. I think what's very interesting is that we see very high response rates, upwards of 50%, and really no other drugs do that. And so I think that's very, very interesting and deserves further study. So there's actually going to be a phase 3 clinical trial looking at the combination. And so we're very excited about that. One of the caveats, though, is the toxicity. So as people familiar with melanoma know, ipilimumab is a little bit harder to use. You have to follow the toxicities very carefully. But I think that's something that we can do as oncologists, just remember to follow the patients very carefully, looking for diarrhea, looking for signs of hypophysitis, and try to afford them a very good response rate. The experience is still very early. The median progression-free survivals were measured in weeks just because we don't have mature enough data, but I look forward to seeing the more mature data later on.